Let's see. I'm gonna try to get as close to get there.
Sure.
Hey guys, this is Dr. Lamb with Mr. Young here. I brought him in to meet with me today because his father-in-law knows me, and they've been through COVID-19. They're on the other side.
It's not as scary as they made it sound. I mean, not for me. I mean, I know some people get affected a little bit more than what happened to my wife and my family, but it wasn't a very scary experience at all.
Okay.
To be honest.
Well, I mean, we don't want to downplay the virus, obviously.
No.
It is a serious virus to deal with, but want to let people know what a person goes through. Now, your father-in-law was like 60 something.
Yeah, he's 66.
66, healthy male.
Yep.
He really didn't have any symptoms that I could recall speaking to him. So how was your experience with it?
So for me, there was one Sunday I was actually out for a bike ride and I just didn't feel 100%. And so the next morning I woke up and I could tell something was still off. And then that night I had fever, light fever, and then I was shivering. And then at night I woke up just fully drenched in sweat. And that happened for 3 nights in a row. And then after that, I lost my smell and taste for 3 days, which was annoying, but not a big deal. But during the 3 days that I was sick, so I would really feel the symptoms at night. I had muscle pain. I had a fever. I would wake up sweating, get up, change my shirt, go back to sleep. I had to take Tylenol one day, but during the day I was still going swimming every day. I'd still go for a walk, typically ride my bike. I have 2 little kids, so I had to keep them busy. The kids were healthy the entire time. And then the only thing that happened to my wife was she lost her smell and taste for 3 days. She had no muscle aches and pains, no shivers, no fever, nothing. So my experience was, it wasn't pleasant by any means, but it wasn't terrible either.
Did it take you out of work or?
Yeah. I mean, I didn't really do a whole lot, with the kids at home. I got a 2-year-old and a 5-year-old, so you can't get a whole lot of work done anyways. But they're actually back in school this week. So.
Oh, cool.
Yeah, so we're back to work. They go to a school here that's open back up.
Well,
it's nice.
Yeah, it is nice. Get them out of the house.
Yeah.
I remember back in 2009, I had swine flu.
Oh, you did?
I did. I was one of the unlucky ones. Yeah.
You're the only person I've ever met that got it.
Really?
Yeah.
Well, there you go. You're the first person on the other side of recovery besides your father-in-law that I know that recovered from COVID.
Yeah.
From what you're telling me, your COVID-19 experience, I mean, I was bedridden for a week.
Oh, you had it?
Or
you mean with the swine flu?
The swine flu.
Yeah,
the swine flu, not COVID,
okay,
but the swine flu. I was out for a whole week.
Wow.
For me to be out and for a doctor to go to the emergency room, that's pretty bad. I felt like I was dying.
Yeah, that's a big deal.
Yeah.
Wow.
So I know from people that have COVID, now besides your immediate family and the person you contracted from, patient number 4 in Collier County, Naples, Florida. Mm-hmm. Do you know anyone else that in your immediate circle that had this COVID?
I think my neighbor did. He worked all through this entire thing. He's in construction, but he hasn't been tested. So I don't know. He had 100% the exact same symptoms I did. So I would say he most likely did, but he didn't actually get a test. So I don't know for sure, I guess. But he, same age as me, same kind of lifestyle, body size and shape and all that. But he was fine. 3 nights of sweats and then lost his taste and smell. Really almost identical symptoms.
Well, that seems to be the common complaint, the loss of taste and smell.
It's annoying, yeah.
It's for 3 days. Did you do anything special during your recovery?
I did a blindfolded taste test, which we thought was a fun thing to do.
That was interesting.
Yeah, my wife took 10 different things, and she blindfolded me and filmed it. It was kind of funny. I guess that was really the only special thing. Other than that, I snuck out to the beach every day. Turned me in, and then swam every day. I mean, I did go in the pool. I mean, my legs hurt enough where I was trying not to overexert them, but it wasn't a tough road to recovery. So,
well, I remember the reason how this conversation came up was because your father-in-law was a patient of mine, and we had to do the screening at the door. With that question, hey, do you know of anyone that had COVID? Is COVID positive? Or are you COVID positive? And temperature.
Yeah.
And at the front door, he said, Me.
Yeah, me. Yeah.
So the staff at that point, that was pretty early on. So my staff was a little worried. So my staff called me on the radio and said, "Hey, Dr. Lamb, a guy here says he has COVID. Well, what are we to do?" Everyone's panicking, you know.
Sure.
And so I called up. So I called him up on the cell phone and said, "Hey, tell me a story." So he told me the story. He said, "Oh, you know, I'm on the other side of it. I'm done. I had it. But I'm on the other side. I'm perfectly fine. And yeah, come on in." So saw him, took care of him as usual. And
Yeah.
And so that was my experience with your father-in-law.
Yeah.
He told me about the whole story, about the whole family, etc.
I mean, to be honest, I'm kind of glad that I got it just to get it out of the way, so I don't have to really worry about it anymore. I mean, I went to the grocery store. I hid for a full 2 weeks. I mean, I went above and beyond the 2 weeks that the CDC recommended, just because I really don't want to get other people sick unless they wanted to catch it.
Mhm.
I knew one doctor in town, but she actually wanted to get it so she could just get it out of the way and not have to worry about it. But then they would have had to close her clinic, and it would have been a big ordeal. So
That part is true.
yeah, so it's been a mess for our country, obviously, but a lot of people are, I don't know if overreacting is the right word, but just, maybe more scared than they should be, I think.
Yeah. Especially with my mother in New York, of all places, right?
Yeah, they're getting hit hard. I mean, down here we haven't had as much of an issue.
Yeah, our neighbor in New York, their neighbor actually just released from the hospital after COVID,
Oh yeah.
and they had a big party.
Oh wow.
So I guess more of the story is, I mean, there's a big portion of people that are coming out the other end without a problem.
Sure.
And how do you do when you go out to grocery stores, et cetera? I mean, now everyone's wearing masks and everything, and you guys are probably the outliers now.
I mean, I'm probably one of the healthier people to be around because I tested showing that I have the antibodies.
Right.
But they still make me wear a mask. Yesterday I went to Costco and I had to put a mask.
Yes,
which is whatever. That's fine. It's kind of annoying, but it's okay. It's not a big deal. But otherwise, I mean, it hasn't really changed our normal life. I mean, our normal day-to-day operations. My wife's still working. I'm still working. I work from home most of the time anyways. I have an office, but nobody's in there right now. So it's been kind of back to normal for us.
And Mr. Young works from home. He sells insurance.
Yep. If you need health insurance after all this, life insurance, health insurance, it's
insurance.
fun. Yeah, I know. That's the first that people let go when they have a pandemic or bill problems. But it's important. You never know when you're going to die. You never know when you catch COVID.
Well, talking about life insurance and COVID. Now, if something happened, would a pandemic be covered under life insurance policy?
It is so far. I mean, I haven't heard otherwise.
Okay.
But I also haven't had any clients pass away from it, so I haven't had to deal with it.
Okay.
Actually, in 20 years of business, I've never had a life insurance client die. So if you buy insurance from me, you're more likely to live.
There you go. So this is Mr. Young. I'm gonna put his information at the end of this video, guys. If you need insurance, and you saw insurance throughout Naples, throughout Florida,
all over the whole country.
Okay.
Yep. I'm a broker, so I'm all over the whole country.
And
it's fun.
How has the health insurance industry been dealing with the COVID? I know United, et cetera, have come out with.
It hasn't been too bad. I mean, there's people going in. Really, a simple plan for people that can't really afford good insurance. You can get a hospital and accident plan. It's a hospital admission accident plan. So a lot of people that don't have insurance, I'm really worried about it. A simple low-cost plan like that would be perfect for something like this because you can still go in and not have to worry about the bills. I mean, there's so many people that wouldn't go in and get the care or seek the care that they need and deserve because they don't have the insurance. A lot of people don't use those supplementary plans, but they're fantastic. And the benefits are getting paid. I mean, it's, Medicare is doing a good job of covering the bills from what I've read, and United and all these companies, I mean, they're playing along. Okay. So you can still get insurance.
Okay, good. Now we're talking about Medicare replacement insurance, or we're talking about regular,
whatever. Yeah, Medicare, health insurance, whatever. Yeah. Oh, cool. There's options. There's definitely options. I mean, it's been a wild ride in the last 20 years. I mean, with the Affordable Care Act and on and off exchange, it's been a total mess. But it's got to change and adapt what the market brings.
Well, are there? I know Affordable Care Act did away with a lot of the major medical plans.
Yeah,
major medical, like exactly what you're talking about. Yeah. Are they coming back?
You can get what they call off-exchange major medical plans.
Okay.
So you can still go through United National General, which uses an Aetna PPO network. It's a decent option. If you're going to the doctor 3 times a month and you're on 20 prescriptions, and major medical is not the right plan for you, I mean, you probably need to be in the Affordable Care Act. But for most people that just want their major stuff covered, there's some good options out there. And that it went away for a little while. It was actually illegal to sell regular insurance for a little while because of the Affordable Care Act.
Gotcha.
They have come back around.
Oh, that's awesome.
They're getting better and better.
That's great. That's great to hear. Because,
It's good.
a lot of younger people, they really just want the major medical coverage, is what they need.
Yeah.
They don't go to the doctors as much, but if they do, they can pay out of pocket or get
you want
discount.
it's kind of like a car accident. You want the major stuff covered. You want a broken bone, a hospital admission, a heart attack, cancer.
Yes. Okay.
All that fun stuff.
Yeah, insurance not meant to cover the little stuff. You want it to cover the big stuff, obviously. Okay. So I'm glad that's coming back because it was taken away with the Affordable Care Act. So, and as far as we have a discussion with my patients about Medicare replacement plans. One of the frustrations we get on our side as doctors is that when they are Medicare age, they get Medicare and they get bombarded with these phone calls from insurance agents and say, hey, or even TV ads. I see Humana.
It's crazy and confusing,
right? Yeah. Let's shed some light on that, because from my standpoint, from the doctor standpoint, we like the regular Medicare plans with a secondary behind it, because that way they're not limited by treatments. They're not limited by a network as they would. Let's say if they sign up with like a Humana PPO Medicare replacement, then you're stuck with a small network of doctors. Yeah. There was a time one year where all the oncologists in Naples were kicked off of the Humana plan.
Yeah. Even if they wanted to be part of it, they were all kicked off.
They were all kicked off. They had one guy come in Fort Lauderdale once a week to see all the oncology patients in Naples. How was that legal?
I have no idea. It's crazy. I mean, some of the things that they do aren't supposed to be legal. Like even, I don't know, some of the advertising and things that the government does. I mean, it's really hurt the individual agents. And technically, it's not supposed to be. We're not allowed to do it, but that's a whole different ballgame. But there is good options out there, and that varies by county. I mean, if you're in Collier County, there's a different PPO network that we would put you on versus Lee County. So the plans do vary by county, and it depends on where you reside, wherever you call home. So, and down here, it's a different ballgame because we have a lot of people that go back and forth up north. So there's a lot of questions that we have to ask, just information gathering questions, and then we'll come back with recommendations. But everybody has a different situation. I mean, if we knew exactly when people were going to get sick, when they were going to die, we could sell them the perfect insurance, the perfect retirement plan. But you just have to go off of people's history and what they think is going to happen. There's a little bit of guesswork in it, and we like to give people options and invite them into the conversation, because really it's something you have to kind of figure out together.
Well, a good thing to keep in mind when you're Medicare age and looking at insurance. I know patients that ask me, very well-educated, very well-read patients even ask me, because it's very confusing, right, to the layperson, right?
Absolutely.
You know it because you're in insurance. I know it because I'm on the other end. Yeah, right? Yeah, it's confusing for us too. Yeah. I always tell them, from my standpoint, is don't give up the freedom of Medicare. And just get into secondarily AARP, like a secondary, because that way you can, I mean, Medicare itself is vast. Yes. I would say, what'd you say, like 99% of doctors in hospitals are on Medicare?
Yeah. I've asked doctors before which insurance company they like best, and they said anybody who's on Medicare, because they actually get paid. Because otherwise they basically have to have a full-time staff person fighting back and forth with the insurance companies. Anybody who's been through a hurricane or a car accident, you understand how you have to fight with the insurance companies. And so Medicare seems to be, good insurance. I mean, that's the only reason some of my clients are happy that they're turning 65, is that they finally just get to be on Medicare, which seems to be a bit more stable than, the pre-65 plans that you can choose from.
Correct. The pre-65 plans are all over the place, but Medicare, well, from the doctor's standpoint, the Medicare, they have their set of rules. You follow their rules, you'll get paid. That's the thing with Medicare. Florida Medicare.
That's how it should be.
Or you're not, Medicare in general, right?
Yeah.
But when you go for a Medicare replacement, then you end up with networks, you end up with sitting on a phone trying to explain to a cardiologist why you need an MRI for an ankle.
Yeah.
Or I sat on the phone with, they got better. They got put a radiologist on the other end.
Oh, good.
Yeah, good. But the problem is the radiologist doesn't treat the patient, right?
Yeah.
So they just read the film.
Yeah.
So they're going by what we should do by looking at the film and say, doctor, you don't need this because I have your MRI says this. I'm like, yes, but you're not the one here with the patient and the history of the patient.
Yeah.
So those are frustrations that we get with dealing with private insurance. I mean, they're necessary evil, but I'm not sure if there's a
part of the fun. That's what I say. It's all part of the fun.
Part of the fun. But your job is to educate the masses and to teach them what insurance they may need.
Yeah. Medicare is a pretty neat system for us because we put everybody's information into a computer program and it spits us out in order what the best plan recommendations would be for them. So that the computers actually do a good job at helping us make those decisions. But then there's some network questions and travel questions that they go outside of that and then helps us help the client make the right decision most of the time. You can change that every year as long as you don't have end-stage renal failure.
Every year.
Yeah.
I've had patients that were, I guess, either misinformed to go into an Advantage plan or they were tricked into a Medicare Advantage plan. They think that they're Medicare. So by the time they come to the front desk, they say, wait, I have Medicare. No, you don't. You have a private insurance plan that covers your Medicare. Yeah. And then some of them are in a rush to get back onto regular Medicare the following year. Yeah. So you really have to decide if you're Medicare age, what you need, right? Like you said, you got to predict what you need and what you want out of this Medicare plan.
Yeah. Yeah. The basics of Medicare. I mean, it's unfortunately something that everybody has to learn when they turn 65.
Correct. They've trusted insurance agents like yourself.
Yeah. Yeah. That's what we're here for.
Yeah. So insurance agent with post-COVID, he does, the interesting thing is I saw a movie, I think it was called Pandemic. What's it?
Oh, yeah, Pandemic.
I get them all mixed up now. Yeah. I've watched a couple of them.
Yeah.
There was one, Marky Mark. Yeah. Was that the one, Marky Mark?
I don't think he likes to be called that anymore.
Okay.
Mark Wahlberg.
Mark Wahlberg. Yeah, I guess he had the antibodies, and then they at the end you have to have a pass or something to get around.
Oh, funny.
Right? Yeah. To prove that you have the antibodies.
Had it, yeah.
So I wonder if that's going to happen to you guys.
I don't want to do that, but it would almost be nice. Just
put a tag around.
A yellow bandana or something.
I'm safe.
Yeah.
Right?
People don't have to jump out of the way. I was actually walking down by the beach the other day, and I mean, this woman literally, she almost hurt herself. She probably would have had to come see you and get her ankle fixed, but she dove out of the way off the sidewalk. I was walking with my 2-year-old, and people are scared. I mean, they are.
Yeah.
And, I mean, you should take it seriously, but I mean, you don't have to be crazy.
It's not a death sentence, basically. It's not a death sentence. You haven't, from what I've been hearing from my patient and from yourself and your family so far is, I've had it worse when I had the swine flu. Yeah. I literally could not get up.
Yeah. No, a week in bed is not fun for anybody.
No, week in bed, fevers and chills for about a week, and then going to the emergency room, getting tons of fluids and everything. That really knocked me out. Yeah. But I'm glad to hear that you're on the other side. Yeah. And you have the antibodies. Have you donated plasma and everything else?
I have offered, and believe it or not, it's very difficult to actually go in and do it. I mean, I give blood as often as possible. I mean, I go to the local hospital and give blood as often as I can. I think it's nice to do. We've tried to give the blood, and it's we haven't been able to make it happen.
I remember I was trying to look for it for your father-in-law, and the doctors couldn't come back to me. I asked the Collier County Medical Society, and I haven't received a straight answer, unfortunately.
We contacted the hospital and the blood center down there, and they did respond back, but nobody's really asked us to come in and do it. We're happy to do it. But I don't know.
I've seen it in the movie too. There was another movie, Outbreak, where at the end of the day, it was the plasma that saved everybody.
Yeah, that was a good movie.
Yeah,
a long time ago. That was a great.
Well, that's the good thing about the quarantine. I had a chance to watch all these movies.
Yeah, I know.
I catch up. I get caught up, right?
On Netflix.
Now I get them all mixed up.
Yeah, my buddy Troy and I have been sending movies out to each other. It's fun.
That's good. Well, you look very nice and healthy, and you always stay healthy.
I feel good. Yeah.
Feel good, and you're on the other side. You're sort of like the walking beacon of hope out there.
Yeah, I hope so. Yeah, I hope so. Realistically, I think the numbers are really skewed though, because
it is
like people like me, my neighbor. I didn't submit my test to the government. So I'm not a part of their system. I mean, they don't know that I was tested or even had it. Same with my neighbor and lots of people that I've just, for them, it's a couple days of not feeling great, but you're not going to go to the hospital necessarily or go pay money to get the test. And some of my friends, they wanted me to get another test before they would hang out with me. I said, look, if you want to pay for it, it's $120 or something like that. So you want to pay for it, or you can just hang out. It's been a month plus since I had any symptoms at all. So, and the CDC recommends 2 weeks, which I'm sure even that's probably a bit excessive. So,
it's kind of scary, right? Your home friends asking you to get another test.
I know. Well, I know.
There's two extreme camps. This video may piss off 50% of people that are watching. And
that's okay.
There's no happy medium. Some people, you see on social media, you see on one side they're like raging about the virus and how it's going to kill the world and how it's going to annihilate everyone. And you have the other side who believes the hoax. Yeah. Right. Yeah. So you're going to piss off 50% whichever way you go. But as a healthcare professional, I'm sort of in the middle. I would say it's not that bad. Our hospitals are at 50% capacity right now. Yeah. Elective surgeries have picked up already. We picked up elective surgery already. Yeah. So I don't think it's that bad, but it is something that we need to watch out for. But it's not something that we really should stop our life for.
I agree. I mean, what I think is that if you are high risk, it would have been a lot easier for our country to say, hey, if you're high risk, if you're part of the 5% of the population, you guys stay inside. We'll pay for you. The federal government will send you guys a check rather than trying to send everybody a $1,200 check that doesn't do a whole lot and locking down the entire world. I mean, to me, that seems crazy. I mean, it's, open to suggestions otherwise, but I think it would have been a lot better. Now, hopefully, our country learned a lot from this and the world. Maybe we'll be better prepared and think things through a little differently next time. I mean, this was new for a lot of people. I mean, there's definitely people in our government that are paid full time to watch for stuff like this and be ready for it. Or maybe they need to be reprimanded, but they should be in trouble for I think not acting accordingly or giving the right advice. I mean, they should know this stuff. That's their full-time job.
Well, it was a big seesaw, right? In the beginning,
it was like, sure.
You go from one side to the very next.
A lot of misinformation, really.
So you don't know what to believe, right?
Yeah, of course.
And even now, as we open up, there's sort of like controversy, too fast, too slow, as far as opening. Yeah. But as far as Naples is concerned, I mean, the beaches are nice, right? People get out there, get some fresh air, get some exercise instead of staying home, getting claustrophobic and getting crazy at the house. I went to the beach myself for the last couple of days, and I lived here for 15 years. I hardly go to the beach. For now, really? I've been there two days in a row.
Yeah, when something gets taken away, then you really
right
back. Yeah,
you get to appreciate it.
Once you realize what you have till it's gone.
Yeah. Sure. Oh my God, this thing is down the street.
Oh, it's beautiful. This time of year too. It's so nice.
Exactly.
Nice.
Exactly. Yeah. Well, thank you for spending the time to come in and
my pleasure, sir. Man. Yeah, anytime.
Yeah.
Anytime.
Thank you for educating our public about post-COVID life and COVID life as well as insurance.
Yeah. I hope it helped. Yeah.
Good. Give us a comment if you want him back for anything else. You let me know. We'll bring Mr. Young back. Okay.
Maybe on the next one we'll do haircut tips. Yeah.
There you go. There you go. Perfect. Look at that. We match.
COVID haircut.
Have a good one, guys.